I will talk about prediction and politics, communicative rationality, prediction-allocation problems, and I will tell you in a minute what I mean by prediction-allocation problems. But lastly, this talk and my project, Tübingen is sort of situated in this literature around fairness in machine learning, how we use statistical methods, machine learning methods to inform or make decisions about people. And how can we think about and conceptualize what it would mean for these things to be fair, just, or at least sort of okay from a general perspective. I'm part of this ethics and epistemology of machine learning group. This is trying to work with Konstantin Genin here, and also Teresa in our group. Misha is a visiting PhD student, visited us last year, and so prediction allocation problems, with this term, I mean these kind of public policy problems where we use social statistical predictions, maybe the output of a machine learning algorithm or something like this, to determine the allocation of social goods. And sort of the easy example might be in a healthcare situation, we might record some individual data about a patient. That's left of this slide. All this data about someone, maybe even demographic data. And then we put all this data into our very smart machine, our machine learning algorithm, and that outputs a number. And usually we say this number might be a probability of something. So here you see a doctor who's shown that, well, the predicted risk of stroke within a year is 72%. But then there's a further step where, well, we show this prediction to street level bureaucrat, in our case, this is a doctor, and she has to make a decision how to treat that person. And these decisions usually have an effect on the very outcome we're supposed to predict. Right? We maybe say, well, this patient has a very high risk of having a stroke, and hopefully this leads our doctor here to give medication, treatment, I don't know, things that lower this very risk we're supposed to predict. In very general terms in our work, we are interested in how such predictions shape and structure distributive outcomes of social goods, like healthcare and healthcare resources, jobs, job training. That was sort of the focus of our last year's publication, in fact. And in this talk, I'm actually interested in how these predictions shape political discourse on two levels. On the level of policymakers, when we have sort of to decide on abstract and general policies and algorithmic policies specifically, and also on the level of street level bureaucrats, that is doctors, caseworkers, the ones that will see these predictions and use these predictions to make decisions about people. These predictions, when they're used in these senses, are instruments of governance, and that means they are inherently political. Sort of at no time do I want to sort of deny the political nature of these predictions and these tools. And we have these two layers. Here you see the city council of Tübingen. Sort of policymakers have to decide what general allocation principle to follow, what budget and what treatment options maybe to make available. And a sort of real life example here from Tübingen is the decision who should get what kindergarten places. And they actually use a matching algorithm to make that decision here in Tübingen. And they actually had to come up with a list of priorities where sort of different children would get points. And according to these points, they would get allocated into specific kindergartens, or also would not receive a place in a kindergarten. And we also have this level of street level bureaucrats. They have to implement these high level policies. And particularly, they have to use bureaucratic discretion to navigate sort of three different normative demands they are facing. They want to decide whom to treat, and they must balance the demands of providing optimal care for the individual directly in front of them, while also treating all their clients fairly and enforcing sort of in general the rules of the institutions they are part of. And these three things are not always sort of or sometimes these things might be in tension, and street level bureaucrats, that's sort of a background assumption we take on board here, need to use bureaucratic discretion to balance these kinds of normative demands they're facing. Importantly, neither of these decisions, the general allocation principles to follow, how to implement an algorithmic policy are somewhat external or just prior or just given once we face the prediction group. Rather the opposite, we often want to use such predictions to inform these decisions, right? So our project kind of focuses on the question how we can kind of navigate this tension between modeling work and scientific expertise on the one hand, that might lead to something, or we might fear that it might lead to sort of a notion of technocracy, kind of experts taking over political decisions by somewhat baking in their idiosyncratic normative commitments. So we don't want that, but we still might hope that predictions, models, scientific models more generally, can inform democratic and political discourse, right? That's kind of the two angles between which we are navigating here, and asking ourselves, well, how can statistical predictions, machine learning predictions inform political discourse at policy level and for street level bureaucrats without leading to the worry of technocracy? Our argument in a nutshell goes as follows. Well, prediction allocation problems aren't static. We use these predictions to inform decisions leading to performativity. I will explain a little bit more detail what I mean by that. And the standard prescription then is to manage somehow this performativity. And we argue that this gets the problem wrong. It's actually not performativity which is sort of problematic in these cases. It is that predictions are pragmatically ill-formed. Following this analysis, we present two criteria of adequacy for predictions that inform allocation decisions. We say they should be decision-supportive, but they should also be discourse-supportive. And finally, we argue that accurate counterfactual predictions, for example, using potential outcomes as a modeling framework, can answer both the demands of practical, that is decision-supportive, but also of communicative rationality, that is, they can be discourse-supportive. Okay, I've already given you a sort of brief glimpse into what do I mean by prediction allocation problems. I will now tell you or give you two case studies, two examples, unemployment and pneumonia, for the two kinds of performative effects we are worried about, that is self-fulfilling and self-defeating prophecies. And then we're going to look into this sort of diagnosis of performativity and our sort of proposed resolution, that is predicting potential outcomes instead of just actual outcomes. Okay, this is kind of the structure of these prediction allocation problems as we face them. We have some algorithm, a machine learning algorithm, and that takes as input features like education, employment history, maybe so-called sensitive attributes like gender, maybe race, or these kinds of data. Of, in our case, a recently unemployed person, and it outputs a prediction, y hat, of the risk of that person of becoming long-term unemployed. And on the basis of that prediction, a caseworker now assigns the person to some labor market program, but this labor market program in turn is causally relevant for the employment prospects of the person, the very thing we're supposed to predict. These risk scores are actually used in various different ways. So in Flanders and Belgium, for example, such risk scores are used to prioritize individuals at high risk. In Austria, it was discussed, not yet implemented, to use such risk scores to restrict support for those classified to be at the very high or very low risk of long-term unemployment, sort of support only those with a middling risk under ideas of efficiency or something like this. So what you can see is such general risk scores can inform all kinds of if you like, allocation principles, because we might say that advocates of the Austrian policy, maybe we might call them policy hawks, argue in terms of efficiency, right? Taken at face value, at least, they might hold something like a utilitarian allocation principle, say, well, only treat those where treatment is most efficient. Critics of this Austrian plan worry about exacerbating long-standing structural inequalities in the labor market, and prefer to focus assistance on those that are the worst off. So they might call them policy doves. In other words, they hold kind of prioritarian allocation principle. The worry now is that, well, maybe those with the highest predictive risk are simply more likely to have gotten the least effective supports. And we have actually seen some evidence for that in data we've studied about Switzerland, that the propensity scores, the likelihood of getting treatment, or rather getting no treatment, is the highest for those that are predicted to be at highest risk. But that would mean we are running danger, at least under the Austrian policy, to create a self-fulfilling prophecies, right? Goods, in this case, job training, are withheld from individuals who are considered high risk, but only because historically they would have been denied these goods and whose subsequent poor outcomes are due in part to their smaller share of the goods. Right? So we predict you're at high risk, therefore you don't get access to resources, and it actually turns out that you are at high risk and you become long-term unemployed. So from a sort of epistemic perspective, our prediction was borne out, everything is fine, accuracy is high, but actually only because we made that prediction in the first place. And that's, I would say, somewhat worrisome. So as I said, this could happen even when the predictions are accurate. Like on an epistemic level, nothing alarms us that this is going on. Take a second example, pneumonia. We are sort of in a hospital context, and people present with pneumonia at this hospital, and doctors have to decide whether to admit patients to the hospital or treat them as outpatients. So again, similar structure. We have trained a smart algorithm. We've given or recorded medical history, symptoms, and vital signs of our patients. And we get a prediction, again, we're ahead of the risk of mortality, the risk of that person dying. And on the basis of that prediction now, physicians and doctors have to make the decision whether to hospitalize or follow up as outpatients. But again, this is effectively sort of deciding the level of medical treatment, and medical treatment is actually causally relevant to their survival rates. And this was actually trialed in the 90s in Pittsburgh in a hospital. Luckily, they were very careful and sort of actually studied their algorithm, so it was not used, but they actually tried that in Pittsburgh. When they looked into their algorithm, they used a decision tree that they could sort of actually study. They realized that having asthma and having pneumonia actually leads to lower predictions of mortality risk, which might strike us as weird because both are problems with the lungs. So you would expect that if someone has pneumonia and asthma, the survival rates are actually sort of worse. But it is actually true that in the data this algorithm has seen, if you have pneumonia and asthma, your survival rates are better, because historically doctors have used asthma as a kind of red flag. And if someone presented with both asthma and pneumonia, they would just sort of directly put that person into the ICU, into the intensive care unit, give aggressive treatment, and aggressive treatment in these cases actually helps. So on average, people with asthma and pneumonia in this hospital actually have better outcomes. So the algorithm is right on some level. But were we to use such predictions naively, maybe just by thresholding, the effects could be disastrous for people with asthma and pneumonia, right? Because the algorithm says good survival rates. So it kind of leads to no treatment, but no treatment in these cases actually leads to exactly the bad outcomes we want to prevent. So we are running into danger of a self-defeating prophecy here. And again, this could happen even though the predictions are accurate on our test set and everyone is behaving fairly and responsible, at least sort of to some degree. And to make things even worse, we often want some kind of self-defeating prophecies in these examples, right? Imagine we are having a school and we're trying to predict dropout rates of pupils, right? And we hope, usually, I guess, that by sort of figuring out who is at high risk of dropping out of school, we can somehow target these pupils with sort of support measures and actually prevent them from dropping out of school, right? So in these self-defeating prophecies are often even intended in these cases, right? So what is going wrong in these sort of prediction allocation settings? Why are they so weird? And why are these kinds of problems arising despite seemingly accurate predictions? The answer usually is performativity. That's sort of the general diagnosis, what's going on in these kind of cases. And we say a model is performative when it not only serves epistemic purposes, but it also causally influences the very system it is meant to represent. And it's a phenomenon that is really ubiquitous in the social sciences. So to give you two famous examples, individuals may react to the creation of social kinds, multiple personality disorder, for example, by identifying with this new classification and changing their behavior. This is an example from Ian Hacking. Or, as we've seen in the sort of 2020s, follow on during the COVID pandemic, right? Individuals may react to predictions made by models of viral spread. Right? We might have a good model of how a virus spreads through society, but then because people see these predictions of maybe resulting death numbers or something like this, they actually change their behavior, limiting their social interactions, and sort of defeat the predictions of these models. These are instances of what one might call macro-performativity, right? Because models here have very diffuse effects on entire populations, and it's rather complicated to foresee or anticipate these kinds of effects. Our goal is slightly more sort of limited, or we lower our bar a little bit here and say, well, we are interested in micro-performativity because sort of the effect we're looking at is that a local prediction about an individual is causally influencing the outcome of that, sort of that individual only. And as I said, these effects are partially intended and therefore also somewhat easier to anticipate because, well, we want them, so we build and design these systems in a way that they sort of have these effects. And I think it's pretty clear by now that sort of performativity has something to do with sort of these problems of predictions. Predictions of low motility for asthmatics here are perversely causing them to have worse outcomes by sort of restricting access to treatment. In the long-term unemployment case, predictions of long-term unemployment, for example, for women, are perversely causing them to have worse employment outcomes. Right? That's kind of the structure of the problem we're dealing with. And the intuitive suggestions then is, well, let's deal with these problems, with these pernicious prophecies, by managing this performativity. Well, how do you manage performativity? You can roughly distinguish two camps here. The one is to say, well, let's prioritize the epistemic. We want to have accurate predictions first and foremost, and we endogenize the performative effects, right? We account for our own effect on the system. We in that sense, we still get accurate and epistemically good predictions. We think that has a lot of problems, and I will go through one example why we think so. The other sort of camp is we call pragmatic encroachment, and that just says, well, put the epistemic part on the second place and focus on your goal here, and that is an allocation goal, right? You want to allocate resources. So figure out what your pragmatic, your normative commitment is, and make predictions that help you to realize that, no matter how epistemically correct they might seem on your test set or whatever evaluation method you use. We have three examples that sort of fall under this umbrella: the inductive risk literature from philosophy of science, optimal steering, and policy and decision-focused learning from computer science. I will only talk about optimal steering here in this talk, but I'm happy to answer questions about the others later. Okay, so first, let's briefly look at an attempt to endogenize performativity, that is sort of the first camp, and then look at an example from pragmatic encroachment, how to optimally steer populations into an allocation of social goods that we think is good or desirable. So, endogenization, as I said, wants to anticipate the performative effects. That is, roughly, to make the kind of predictions that tend to fulfill themselves. In this little scheme, you see on the x-axis our predictions, P, and then on the y-axis the outcome, Y. And an accurate prediction just is one that is on this identity, right? Because then our prediction just equals the outcome we observe. And now we say we have a response curve that sort of models the response of people to a prediction and gives us the relevant outcome that would realize where I to make a certain prediction. And the idea of endogenization now is, well, I build a model of this response curve and I find just the point where it is at the identity line, because that is exactly the prediction that would turn out correct under this idea, right? Because that would be the accurate prediction. This is problematic for two reasons, because A, it often leads to normatively undesirable outcomes, and B, it does not respect the pragmatic purpose of these predictions, that is to help decision makers to make better decisions, right? It prioritizes our modeler's goal of making accurate predictions over the decision maker's goal of making good decisions. So here's a little example that hopefully clarifies this idea. Say we are in the setting of pneumonia at the emergency room, and we're sitting just outside observing how people with pneumonia, very sick people, get into this emergency room. And we are very smart scientists, I don't know, took a lot of math courses, and we start to make somewhat cynical bets on the outcomes of these patients, right? We just bet with each other. Our bets are now private, right? And we can just sort of play that game, and if we're good modelers, we will win some money, hopefully. But the doctors realize that we're sitting outside there and are convinced that they're very clever people, so they begin to use our bets to make intake decisions. That's roughly speaking, our bets become public and they're used in decision-making. That's sort of roughly the situation of what happens if we naively use predictions to make these intake decisions. Well, but now we realize that more patients that we had bet would survive. But we say these asthmatics plus pneumonia people, very good rates of survival, they start to be sent home and be exposed to high risk. So our amusement is disturbed, right? We have not taken into account the effect of our predictions on the intake decisions. Well, now we say, well, let's endogenize our effect. Let's model sort of how our predictions affect our the decision by doctors. And make new bets. But we know that increasing the predicted mortality leads to more intense treatment, right? That's sort of roughly how this response model works. So we must predict that asthmatics are at higher risk so that they're actually getting treated. But there is clearly a limit to how higher risk we can assign them, because were we to predict too high a risk, they all would get treated, and then they would actually realize a low risk, like good survival rates, right? So our bets would turn out to be wrong again. Our predictions would once again be frustrated. So the only way really to endogenize the effect seems to be to assign them a middling risk to confuse doctors enough to result in middling outcomes for these people. And I think that somewhat clearly brings out why this seems to often realize sort of worse outcomes for the people affected, but it also doesn't seem to take serious the modeling task we're faced with, right? It's not to make good private bets with each other. It's helping doctors to make better decisions about people. Okay, so maybe just focusing on the epistemic is not a helpful approach in these cases where we inform decision-making. So let's go to the other extreme, if you like, and say, well, then we don't care about, well, don't care, but we put the epistemic on a sort of secondary step and say, well, let's make the predictions that help us realize whatever allocation outcome we want to realize. And optimal steering is an attempt by a computer scientist, here you see Juanqui Perdomo, to sort of account for these performative effects by statistical models. And he writes in his PhD thesis, actually, if predictions can shape the world around us, if they are performative, that is, the design space of optimal predictors is significantly more expansive. In particular, the goals of prediction may not be just to accurately forecast future outcomes, but also to actively steer them towards socially desirable targets. Right? So modelers all of a sudden become these captains on our ship society and make predictions that realize specific social goals. But this is also problematic, I would say, from various perspectives. Because, well, in our long-term unemployment example, how would we actually steer caseworkers to make the right decision from our perspective now? It recommends a somewhat insincere attitude towards street-level consumers of our predictions. It again presupposes that we have fixed this normative goal of allocation, because we need to sort of tailor our predictions toward one. And in doing so, it forecloses the possibility that predictions might helpfully inform political discourse about which normative goals are feasible and attractive. And even worse, street-level bureaucrats might realize that they are steered, right? Do we have to kind of anticipate their anticipation of our anticipation, right? That's kind of, we might start having this kind of regress problem here, where we have sort of performativity on various levels. In fact, sort of this turns out what is meant to be a cooperation between modelers and decision makers into a strategic interaction. And once decision makers begin to suspect that they're being steered, this might ultimately undermine the goals of optimal steering. I think a different way to understand this problem is actually to go back to Austin here, who coined this term of performativity, and to distinguish between two kinds of effects, right? To sort of start a pragmatics of predictions, if you like. And we have these two levels how we can understand the pragmatics of speech acts. Illocutionary forces here describe the conventional communicative significance of an utterance, whereas the perlocutionary effect sort of describes the causal effect an utterance has on a hearer. For example, if someone tells me, well, you're standing on my foot, this might sort of just has the illocutionary force of sort of telling me, please step away. But it might also have the perlocutionary effect, the causal effect of me causing me to, I don't know, feel shame, for example, for having stepped on someone's foot or something like this. I think we can understand this proposal of optimal steering as basically going perlocutionary, right? We only attend to the causal effect that predictions have on the hearer, rather than understanding the communicative function that is conventionally meant to serve, that is informing hearers, decision makers about the consequences of various courses of actions. And with Jürgen Habermas, I think sort of we can understand this critique of optimal steering a bit better when he says, well, a speaker can pursue perlocutionary aims that are sort of only focused on the causal effect of an utterance and not on the understanding, only when he deceives his partner concerning the fact that he's acting strategically. And he continues, otherwise, if he's not deceiving his partner, he has to expect that the other participant will feel deceived and adopt a strategic attitude in turn, steering away from action-oriented to reaching understanding. So, summarizing this, pragmatic encroachment approaches fail to support rational deliberation among policymakers and street-level bureaucrats with different normative commitments, because they kind of pre-bake in the normative commitments into the predictions. Optimal steering is kind of the most extreme, by sort of recommending to only make the predictions that realize a specific allocation goal, not attending to any kind of representational accuracy or anything like this. But decision focus and policy learning are sort of maybe not as bad, but they also bake in specific normative allocation principles in the decision, in the recommended decisions. So the predictions here are specialized to optimize a preferred allocation principle rather than predicting the consequences of different allocation policies. And one example from our last year's paper, where this might be particularly bad, is when, well, two normative commitments, like the prioritarian and the utilitarian perspective, might just agree on what to do. In some cases, this might be the case. And in our example, where we looked at the resulting long-term unemployment shares under these two algorithmic policies, you see here on the y-axis the resulting long-term unemployment share, and in blue and red, it's not super well to see because this graph was not optimized for showing that fact. But what you see is they are overlapping, right? These two lines the solid red and the solid blue line, they're just overlapping. One, the blue is representing the effect of a prioritarian policy on long-term unemployment. The red is showing a sort of utilitarian effect on long-term unemployment. And the fact that they're sort of resulting in the same long-term unemployment shares just means that in our case, those at the highest risk are also those where our treatment is the most efficient. And sometimes this might be the case, and sometimes we just don't have these policy fights about these allocation principles. But we need a way to realize that. And if we bake in all our normative commitments already in the predictions, there's actually no way for us to sort of realize that there is no problem, at least in these cases. Note that this might not, like this is not, will not always be the case, right? Sometimes there will be actually conflict about what to do. But even then, we argue we should realize what the consequences of the different decisions are and not just provide sort of the relevant decision for one of the two camps. So that brings me to sort of to my last part of the talk, kind of what to do in light of these problems. As I said, the sort of standard prescription to this problem is, well, manage performativity. And I've shown you two sort of exemplary attempts to manage performativity. One was endogenize your effects. The other was use optimal steering. I hope I've convinced you that both are somewhat unsatisfactory and that we might hope for an alternative. And we give an alternative diagnosis. That is, statistical predictions result in these perverse effects because they're infelicitous. They're pragmatically ill-formed for these prediction allocation contexts. And we argue that when we go counterfactual, when we make counterfactual predictions, they can provide unambiguous guidance for allocation and policy decisions. What do we mean by this ambiguity here? Predictive expressions like this patient is at high risk are ambiguous because they admit to several interpretations with different bearing on actions, right? We might mean this patient is at high risk whatever you do, or we might mean this patient is at high risk unless you intervene. Both seem to be natural interpretations of this predictive expression, but it is taken for itself unclear what we actually mean. And even worse, standard statistical predictions are properly interpreted as contemplative, right? They say something like this patient is at high risk if you proceed as usual, if the world is somewhat sufficiently stable in the relevant sense. So given the description of an individual, they prophesy a likely outcome in part by guessing what treatment they will receive. And that is exactly what we argue, that contemplative predictions are infelicitous, pragmatically ill-formed in these contexts, because that is just not the relevant information we pragmatically need to make decisions about people. What can we do instead? Well, we think what we need are accurate predictions of the counterfactual outcomes. Were we to intervene, were we to, for example, admit a patient to the hospital, or were we to do nothing or treat them as outpatients? And we can write these cases as potential outcomes. That is, basically we expand our outcomes. Before we simply had the y as outcome, and now we have a vector of outcomes that is sort of indexed by the different actions, the different treatments we have available. And that makes it sort of, I think, more clear what we mean by this ambiguity here, because statistical forecasts are ambiguous because they estimate the mixture. They tell us what would happen were we to intervene or were we not to intervene. D here is just a binary decision or treatment variable. And sort of if we do standard statistics, we just focus on the actual outcome, y. And instead we say, well, let's take this problem apart. Let's try to estimate counterfactual outcomes under the relevant treatment options. In other terms, pernicious prophecies are caused by a failure in the pragmatics of predictive expressions. And here you have Lukas György, who used that term of reification a lot, because just focusing on actual outcomes instead of counterfactuals basically means that we treat social statistical regularities as natural laws to which we can accommodate ourselves, but which we cannot change. In fact, they obscure the fact that these outcomes are to a significant degree under our control. They are part of the choice set we have available. So accurately estimating counterfactual outcomes addresses the problem of pernicious prophecies, right? Rather than forecasting mortality, present physicians with the projections, the counterfactual predictions of mortality under the relevant treatment option, that is inpatient or outpatient treatment. Or rather than forecasting unemployment, present caseworkers with projections of unemployment under the different job training or program options. We think potential outcomes are less reified than forecasts because they wear on their face, so to speak, that the outcomes that we'll realize are due to our own decisions, right? This lack of ambiguity, though, only establishes an advantage over standard predictions and not so much about optimal steering or decision-focused learning, right? Because they also admit this kind of causal effect on the outcomes and just say, well, fully embrace the normative commitments you might have. Our argument in the end is a normative one. Unlike pragmatic encroachment strategies, the predictions of the counterfactual predictions, projections that is, answer to the demands of communicative rationality. And we can sort of use this topology of rationality, which we took from Habermas, and he basically builds on Weber here, to say, well, there are different action orientations. So we might work sort of individually or in groups, social, but we can also be oriented towards success. That is kind of the playground of standard decision theory and standard game theory, if you like. But we might also be interested in consensus building, in building understanding, right? And that is the field of communicative rationality that, I mean, Habermas famously sort of championed and worked on. And he argues that kind of having a greater degree of cognitive instrumental rationality produces a greater independence from limitation imposed by the environment on the self-assertion of subjects acting in a goal-directed manner. But similarly, also a greater degree of communicative rationality now expands the scope for unconstrained coordination of actions and consensual resolution of conflicts. So sort of building on these ideas, we say, well, a prediction is decision supportive for an agent A if it allows her to accurately implement and evaluate the policy options she faces in light of her own goals and values. Standard forecasts, standard statistical predictions are usually not decision supportive, at least in prediction allocation problems. But methods from pragmatic encroachment, like optimal steering, decision-focused learning, might be decision supportive, right? That's the very purpose they're built for. Once you give me your normative commitment, I can give you the predictions that sort of are decision supportive for whatever your goal is. But predictions also serve as public reasons in these contexts, right? In political discourse, several agents, policymakers, street-level bureaucrats discuss collectively which of a number of policy options is best, all things considered. And to do so, they must be able to sympathetically identify with the goals and values of the others, even if they might ultimately reject them in favor of their own. Right? That is to say, maybe in an ideal case, we're in the situation I just presented to you, where the utilitarian and the prioritarian principle just sort of give us the same treatment. They're best from both perspectives. But even if this is not the case, it is important to see whether the best policy from the perspective of A might not also be somewhat acceptable from the other perspective. Or maybe we can form some compromise between them, right? That is to say, predictions should serve as public reasons. Reasons agents with different normative commitments can accept and use to project the consequences of their actions. So we say a prediction is discourse supportive if for a set of agents, it allows each agent to accurately evaluate the policy option in light of their own goals and values, as well as the goals and values of the other participants in the discourse. And what we need for that are accurate counterfactual predictions, say of potential outcomes, because they allow agents to project the consequences of theirs and other actions and policies and to compare the allocated effects. And we get these kind of accurate counterfactual predictions that are actually discourse supportive. Well, the notion of accuracy here is sort of actually, from a technical perspective, super relevant, and that's sort of more foreshadowing of a more technical project that might come or follow to this project, because sort of the usual methods we might use to get these kinds of counterfactual predictions like W-robust machine learning only yields unbiased estimates. But unbiased estimates might not be enough to actually support, to give us discourse supportive predictions, because they might not give us optimal predictions from the perspective of a number of normative commitments and allocation principles. There are, though, attempts to use concepts like multi-calibration, multi-accuracy, because they might yield something people have called performative omni-predictors, and that's actually my last slide. Here you have Hyun Keith Adomo again and Michael Kim, sorry. And they write in this paper on performative omni-predictors, intuitively, a performative omni-predictor is a single predictive model that is simultaneously performatively optimal for many diverse objectives. By diverse here, we mean that these omni-predictors can be used to generate optimal predictions for qualitatively different and possibly contradictory goals. And what is interesting is that their model of nature, the thing they want to estimate, just are potential outcomes, because it's just the Cartesian product of the features with the predictions, which is again mapped into a prediction, into an outcome. So you can just understand their target, their theoretical target, what they want to estimate, as a potential outcome. Okay, with that, I'm at my summary slide. In prediction allocation problems, predictions are used to allocate social goods. But predictions here causally influence outcomes, leading to performativity, self-fulfilling and self-defeating prophecies. The standard prescription then is to manage this performativity, either by endogenizing the performative effect, or by using sort of attempts from the pragmatic encroachment school. And we have argued that this kind of diagnoses the problem wrongly. The problem is actually that predictions are infelicitous, they're pragmatically ill-formed. And consequently, we propose two criteria of adequacy for predictions that inform the allocation of social goods. They should be decision and discourse supportive. And we've argued that counterfactual predictions can answer the demands of practical and communicative rationality for both policymakers and street-level bureaucrats. And yeah, that's my talk. Thank you very much.